Trapped nerves is one of those peculiar conditions where it's not a condition itself, but it's searched for loads on the internet, and patients will always come in saying, I think I've got a trapped nerve here, here or here. And invariably they're talking about a trapped nerve maybe somewhere over here or somewhere over here, and it's that sensation of something being trapped. But frequently the location that is being pointed to is not actually where there are really any nerves to be trapped, and nerves can really only be trapped in one main spot when we're talking about along the neck and lower back, and that's as they exit the spine or inside the spine itself. And this is invariably caused by some degree of injury in that region. So we'll explain in this video a little bit more about trapped nerves correctly, and how the anecdotal version of a trapped nerve is the best way of explaining the sensation that you're feeling. Now, quite often trapped nerves are used in the top part of the neck or the top part of the spine, and when it's in the lower back, people just say I've got sciatica, which is essentially a specific nerve that is being trapped. But if we take the example up top, and you can apply it if you think you've got a trapped nerve in the lower back to that lower back section. But people will often comment that somewhere in this region here a nerve feels trapped. It might be just on the shoulder or just to the left, etc. of the spine. And what these trapped nerves are is essentially that something in this region of the spine here is injured. It's creating inflammation. And periodically, maybe when you turn the neck, that irritates that little nerve, and you feel that as a sensation somewhere slightly elsewhere. It might even go all the way down the arm in the case of a more severe radiculopathy, as a result of some sort of disc injury in the neck here. But trapped nerves generally are a sharp sensation as you're turning the head, and they're caused by an injury to a section of the spine. And that in that injury, we're getting inflammation building up in these tiny little holes where the nerves exit, and movements put pressure on that inflammation, which then puts pressure on the nerve, and you get those nerve symptoms. Now, how do we treat these sorts of things? The biggest problem we find with patients when we're treating these conditions is not so much the actual treatment itself, but it's the perception of where the treatment is. It hurts here, why are you doing the treatment here? And the reason for that is that where the sensation of the trapping nerve is not always where the symptoms originate from. So quite often we're going to trace that nerve back to where it starts, and that's where the injury is, and that's where we can treat. So by treating the neck, by treating the discs or section of the neck that's involved, we can actually alleviate the symptoms. And once more, in a lot of cases, you might feel it in the shoulder, for example, but actually when we get you doing a few movements of the neck, all of a sudden you feel it in the shoulder again, and that's because we're moving this section where the injury is. Now, the treatments themselves, it's very, very simple. We've got some sort of compression pathology. The main role of the spine is to weight bear and load bear, and something has failed in that process. And often when we take pressure off that spine, you find that actually the symptoms really, really abate. They really release, really feel better. So we do an element of IDD therapy in a lot of cases like this, where we take pressure directly off those injured sections of the spine so they can have a breather. It does a little bit more than that, and you can read more on the IDD section of our website, but essentially it's taking pressure off those injured structures. Then we use laser therapy. This is fantastic because sometimes the pain associated with a trapped nerve can be so severe that you can hardly move your neck, and you find yourself looking like a robot when you're moving around the place. And that is because there's so much inflammation in this section of the spine. So we do laser therapy to reduce the inflammation and speed up the healing process. That's really, really important. And for someone who's in excruciating pain, it's so easy to have done because you don't need to move, you don't need to do anything. You just sit there or lie down and we can do the therapy for you. Now, the problem with getting these sharp stabbing pains is that you get a lot of muscle spasm. That hurts. You can't stay still. The muscles are in spasm. They're creating more problems. So we do some vibration therapy, which is often very, very relieving, to actually reduce the muscle spasm in and around that section of the spine so that it can take pressure off or complement the decompression that we've done, the IDD therapy, by just allowing a little bit more easy movement so that we're not re-aggravating those same tissues. And those are really the three main components. We'll also do a little bit of work as spinal adjusting. If there's any underlying issues, we can get these joints to move in the right direction so they move back towards a normal position and they're not constantly putting pressure on that trapped nerve. And that is really how we approach the treatment of trapped nerves. Now, you can learn more about on our website exactly what trapped nerves are and read a little bit more on how we approach the treatment of them. But I hope that video was helpful for you, and if you've got any questions about your trapped nerves, how long it's been going on, or how we could help you, then use any of the contact modalities on our website to get in touch.